So the topic today is loop diuretics. What is diuretics? Diuretics means which increases the amount of urine in our body. Along with urine, it also increases sodium chloride and some other ions. So before going into loop diuretics, we need to see some basic anatomy and physiology. Starting with anatomy. So this is the basic structure of a nephron, where this is the Bowman's capsule, proximal convoluted tubule. If you will further go ahead, the starting of Henle's loop will be there. This is the descending Henle's loop, this is the ascending Henle's loop, and this is the thick ascending limb of the ascending loop. This is the distal convoluted tubule and collecting duct. Going for some physiology. So what is primary active transport and what is secondary active transport? If the energy is used directly for the transfer of some molecules against the gradient, then it is called as primary active transport. Like this sodium potassium ATPase uses energy for transport of molecules against the gradient. So this is primary active transport. But due to primary active transport, there are some gradient created inside the cell, due to which or in that gradient some energy are stored, which stored energy is used to transport some other molecules. Then it is known as secondary transport. Okay, so in secondary transport, inside the thick ascending limb, sodium, potassium and chlorines are entered into the cells. So this is the normal physiology. And when the chlorine will enter into cells, along with the chlorine it will bring calcium and magnesium with it. So in the thick ascending limb, like in this position, sodium, potassium, chlorine, calcium and magnesium reabsorption occurs in normal physiological circumstances. And these three, sodium, potassium and chlorine, are like symporter in the secondary active transport. Symporter means these three will move in the same direction. These three will move in the same direction. So when we will add some loop diuretics, the loop diuretic will inhibit these three symporter, or it will inhibit the secondary active transporter, due to which these three molecules cannot enter the cells or cannot be reabsorbed. Why reabsorbed? Because absorption occur in the intestine, and in nephron it is reabsorption. So when we will add some loop diuretics, it will inhibit the secondary active transporter, due to which sodium, potassium and chlorine reabsorption will be inhibited, due to which these three molecules will move in the direction of urine formation. Along with chlorine, due to chlorine is not absorbed after taking diuretics, so these calcium and magnesium ions will also do not reabsorb and enter into the urine. However, the calcium reabsorption occurs in the distal convoluted tubule. So calcium is reabsorbed in the distal convoluted tubule, but all the remaining ions do not reabsorb, due to which in our body hyponatremia, hypocalcemia, hypochloremia and hypomagnesia occurs. This is the result of loop diuretics. Some of the examples are furosemide, bumetanide, and the clinical uses of the loop diuretics. In general, it is used in edema.